female, been on dialysis for 1.5 months via permacath, had normal renal function over a year ago, but had rapid decline with the onset of multiple myeloma, past medical history, significant for hypertension, diabetes, and coronary artery disease. So our checklist, we got the IV in the ipsilateral hand. Patients had antiplatelet medication. We have heparin on the table. We have an arm block in. We are going to check the artery and vein, which we're doing right now. So I've got on the screen there both the basilic and the cephalic vein. There's the basilic, and here's the cephalic, which is going to be our target outflow. Here's the confluence where they come together and the perforating vein comes down. And right there, it's right next to the artery. So the artery is the bigger structure right there. So that's where our crossing point. So let's go in the long view for a minute. And there's our long view of the perforating vein. It's hard to get the whole thing on there at once. So we'll have a little jog when we move from the median cephalic vein down into the perf, and that'll be the challenging part of the case. But what we want to do is we want to enter that median cephalic vein at about 1 o'clock so that we're at the lateral aspect of it, and because ultimately our needle is going to need to go medial to cross into the artery. All right, so let's get started. Lidocaine. So we use lidocaine just to make sure things are numb. All right. Yeah, don't think she felt that. Okay. So a little bit of pressure there. There we are. We're sort of over at 2 o'clock. There we are entering the vein. And let's put the tourniquet up. That was our final checklist piece, so let's do that. Okay. All right, there we are at 1 o'clock, and we're in. Felt like we went in. No, we went down next to it. Hang on. Okay. Now we're in. All right, so we're getting to the confluence there, and now we're in the perf. And we're just coming down the perf. See that little shadow? There's a little better there. Just keeping it in the middle. All right. And we're then almost past the artery. So we're going to sort of put it at the again at the 1 o'clock spot on the artery in the transverse. We're going to look both ways before crossing. And there's our needle coming down the perforating vein. And there it is on top of the radial artery. We're going to bring it in a little bit better. That's where I like it, in that view. I'm going to now look in the transverse. You can see we're more at 12 o'clock on that. And we're going to advance. And it looks like we have arterial blood flow. So, I'm going to find the needle again and advance the wire down. We go down the artery. Yes. Okay. So we're just double checking, making sure it's down the artery. All right. That's the crossing. I'm going to turn over the transducer to Wendy Jones. She's our ultrasound tech extraordinaire. And I'm going to leave the tourniquet up still. Okay. And she's going to keep the pertinent anatomy in view while we do the next couple of steps. Let's check the catheter, get it ready. And here comes the device in the sheath, the sheath. Sheath is in, and I'm going to change wires. And then I'm going to give heparin. Wires in. All right. And 3,000 heparin. Okay, device. All right, we're going to turn the device with a thumb tab towards me, opposite the direction of crossing. You can see the device come down the sheath into your picture. It's open. Okay, and it's in the tips and the artery. We're going to leave that position. Okay. All right. Yeah. What's the, it's closed? 0.4, that's a good gap. All right. And the sheath is back enough. Let's go ahead and activate. Verify close. And let's activate. Yes. Okay. Now off. Sheath still in. Feed wire. Okay. All right. Take it off. Okay. Tourniquet off. All right. We'll check the BA flow while we're getting the balloon ready. Pretty good. Nice diastolic component. So 540. Pin the line. All right. Okay, we're across. All right, let's sheath. Okay. Okay. All right. So center on the. There we go. All right, balloon up. Okay. Okay, 12. A little more. 14. Okay, down. It's seeding out a little bit. Okay, do that one more time. 12, good. All right, 14. Okay, good. All right, back to 12. Okay, can hold it at 12, 14. All right, down. Okay, feed wire. Okay, let's just get the brachial artery flow. .801. All right, so that's kind of a wrap. I'm going to pull the sheath and wire out. So we're all done. Nice job.